Southern California's ICU availability remains at 0%. However, Marian Regional Medical Center in Santa Maria still has room for patients. News Channel reporter Patricia Martellotti explains how they're staying ahead.
As we continue to see the number of COVID-19 cases surge across the Central Coast.
It's a pretty scary thing. I mean, it's been around going for close to a year now.
Doctors at Marian Regional Medical Center are seeing more patients coming through the doors.
We've definitely seen a surge in patients requiring hospitalization for COVID-19.
Doctors say they made plans for potential surges like this well in advance of it happening.
We're seeing surge levels today that are much higher than what we saw in July and August. We continue to have the need to care for patients in our hospital and their critical care units. But putting our surge plans together, we've been able to expand that capacity and continue to care for those in need.
Doctors are monitoring the number of ventilators and nursing staff to ensure everyone gets the care they need.
Certainly, if the pandemic is worsening over the next several weeks, depending on how people behave outside of their homes, we certainly could see a worsening situation. And so that's why it's important that people continue to take their infection prevention measures very seriously.
Try to prevent from doing the things that you don't really feel like need to be done. The gatherings, obviously, everyone wants to see their families, everybody misses everybody, but if you can do all those things to prevent from even one person getting sick, then it's worth it.
In Santa Maria, I'm News Channel reporter Patricia Martellotti.
Hospitals are asking the community for help containing the surge as COVID cases spike across Santa Barbara County, as we just heard with Tracy Lair. Public Health says 30 more people are in the hospital this week than last week. Cottage Hospital is up 10 patients during the same time. And there are just 6 intensive care unit beds left at the hospital.
We have a very small amount of capacity left with regards to our staff. When we pass that, and I say when, not if, but when we pass that, we're going to rely on what we call surge. And surge is basically all the plans that we have in place to creatively staff the care of patients, to care for patients perhaps in regions of the hospital that we don't usually care for patients.
Dr. Fitzgibbons thinks that the end, though, could be near, and life can go back to normal if the community takes steps to limit the spread. San Luis Obispo County is also experiencing an onslaught of COVID-19 cases, and that is putting more patients in the county hospitals and decreasing the number of available beds. Public Health lists a total of 369 beds located throughout county hospitals right now. State data shows there are just 17 remaining ICU beds available in San Luis Obispo County. At today's Board of Supervisors meeting, Health Officer Dr. Penny Borenstein says that the county is not in a crisis, but she is growing worried as cases mount.
We're not in trouble at this point.